Have you ever started taking a medication to protect your heart, only to find yourself wondering why you suddenly feel exhausted all the time? Maybe you're sleeping 8 hours a night, yet you still wake up tired. Perhaps climbing the stairs leaves you feeling drained, your afternoon energy disappears, or you've simply stopped enjoying activities you once loved because you just don't feel like yourself anymore. If you're over 60 and taking medication for high blood pressure or a heart condition, you may have asked yourself a difficult question: is this just aging, or could something else be contributing to how I feel? The answer isn't always simple, and that's exactly why so many people become confused. Today we're going to talk about two of the most commonly prescribed cardiovascular medications, Amlodipine and Metoprolol. Both medications have helped millions of people manage high blood pressure and reduce the risk of serious cardiovascular problems. But because they work in different ways, they can also have different side effects. Later in this video, I'll explain why some people feel more tired on one medication than another, the warning signs you should never ignore, and the simple conversation you should have with your healthcare provider before making any changes to your treatment. Welcome back. If this is your first time joining us, we're glad you're here. Our goal is to help adults over 50 better understand their health using practical, evidence-based information. We believe that informed patients make better decisions and that understanding your medications is an important part of staying healthy and independent as you age. Let's begin with something we all know. As we get older, high blood pressure becomes much more common. You may not feel it happening because hypertension often has no obvious symptoms. Yet over many years, it can quietly damage the heart, brain, kidneys, and blood vessels. That's why doctors prescribe medications like Amlodipine and Metoprolol. These medicines are designed to reduce the strain on your cardiovascular system and lower the risk of heart attack, stroke, and other serious complications. Although these medications are sometimes discussed together, they belong to completely different drug classes. Amlodipine is a calcium channel blocker. It relaxes blood vessels so blood can flow more easily. Metoprolol is a beta blocker. It works by slowing the heart rate and reducing how hard the heart has to work. Because they affect the body differently, it's understandable that some people notice different experiences while taking them. Now here's an important point that many people never hear. Feeling tired does not automatically mean your medication is causing the problem. Fatigue is one of the most common symptoms in older adults, and it can have many possible causes. Poor sleep, dehydration, anemia, thyroid disorders, depression, chronic pain, diabetes, infections, vitamin deficiencies, and even stress can all contribute to low energy. Sometimes several of these factors occur at the same time. However, certain medications, including some blood pressure medicines, can contribute to fatigue in some individuals. For example, because metoprolol slows the heart rate and reduces the heart's workload, some people notice that they feel less energetic, especially when they first begin taking it or after the dose is increased. Others adjust within a few weeks and feel completely normal. Every person's response is different. Amlodipine, on the other hand, is less commonly associated with fatigue, but it has its own potential side effects. Some people experience ankle swelling, flushing, headaches, or dizziness, especially when first starting the medication. Again, many people tolerate amlodipine very well and experience few or no side effects at all. This brings us to an important truth. The best medication isn't the one that works perfectly for someone else. It's the one that safely controls your condition while causing the fewest problems for you personally. That's why doctors consider your age, other medical conditions, heart rhythm, kidney function, previous heart attacks, and many other factors before choosing a medication. Think about it this way. Two people may both be 72 years old with high blood pressure, but one also has coronary artery disease and an irregular heartbeat, while the other has swollen ankles and diabetes. Even though they have the same blood pressure reading, they may benefit from completely different treatment plans. Personalized care matters. As you continue watching, you may begin recognizing patterns that sound familiar. Maybe you've noticed your energy dropping shortly after starting a medication. Or perhaps you've been blaming yourself for feeling tired, assuming it was simply because you're getting older. Understanding these possibilities doesn't mean your medication is the cause, but it does mean your concerns deserve a thoughtful conversation with your healthcare provider. Here's something else worth remembering. Never stop taking a prescribed blood pressure or heart medication on your own because you suspect it's causing fatigue. Suddenly stopping certain medications, particularly beta blockers like metoprolol, can sometimes be dangerous. If you believe a medication is affecting your quality of life, the safest approach is to speak with your doctor. In many cases, they can evaluate other possible causes, adjust the dosage, change the timing, or recommend a different medication if appropriate. I'd like to ask you something because your experience could help someone else. Have you ever started a medication and noticed a change in your energy level? Did you discuss it with your doctor? And what happened afterward? Share your experience in the comments. Hearing real stories often reminds others that they're not alone and encourages them to ask important questions during their next appointment. Before we continue, remember the promise I made at the beginning. I said I'd explain why some people seem to regain their energy without necessarily stopping their medication. The answer isn't as obvious as you might think, and in the second half of this video, we'll explore the lifestyle factors, hidden medical conditions, medication timing, hydration, nutrition, and everyday habits that can all influence how energetic you feel while taking blood pressure medication. You'll also learn the warning signs that should prompt you to contact your healthcare provider without delay, and the questions that can help you make the most of your next medical visit. Now let's continue by answering the question that brings so many people to this topic. If you're taking amlodipine or metoprolol and you constantly feel tired, what should you actually do? The first step is not to assume your medication is entirely to blame, but also not to ignore how you're feeling. Your body is giving you information, and it's worth paying attention to. The goal is to work with your healthcare provider to understand the complete picture rather than making changes on your own. One of the first things your doctor may look at is your blood pressure and heart rate. Sometimes medication lowers pressure exactly where it should be, and you feel perfectly fine. Other times, blood pressure may become lower than intended, or your heart rate may slow more than expected, especially with certain beta blockers like metoprolol. For some people, this can contribute to symptoms such as fatigue, lightheadedness, or reduced exercise tolerance. That's why regular monitoring at home and during medical appointments can be so valuable. A simple blood pressure log often provides important clues that neither you nor your doctor would otherwise notice. Another important consideration is when you take your medication. Some people find that taking certain medicines in the morning works best, while others feel better taking them later in the day. The right timing depends on the specific medication, your daily routine, and your healthcare provider's recommendations. Never change your schedule without discussing it first, but don't hesitate to ask whether a different timing might better fit your needs. Hydration is another surprisingly common issue. As we grow older, our sense of thirst naturally declines, making mild dehydration more common than many people realize. Dehydration itself can cause tiredness, dizziness, headaches, and weakness. If you're also taking medications that affect blood pressure, staying properly hydrated becomes even more important unless your doctor has advised you to limit fluids because of another medical condition. Nutrition deserves attention as well. Skipping meals, eating very little protein, or relying heavily on processed foods may leave you feeling sluggish, regardless of which medication you take. A balanced eating pattern that includes vegetables, fruits, whole grains, lean proteins, healthy fats, and adequate fiber helps support overall energy levels and cardiovascular health. While no single food is a cure for fatigue, consistent healthy eating provides your body with the nutrients it needs to function efficiently. Physical activity may seem like the last thing you want to do when you're already tired, yet it often becomes one of the most helpful habits. It sounds almost backwards, but regular movement can improve endurance, strengthen muscles, support healthy circulation, improve sleep quality, and increase energy over time. That doesn't mean pushing yourself to exhaustion. Even a comfortable daily walk, gentle cycling, water aerobics, or light strength training can make a meaningful difference when performed consistently. Sleep quality should never be overlooked either. Many adults assume they're getting enough sleep simply because they spend 8 hours in bed. But conditions such as sleep apnea, restless leg syndrome, chronic pain, or frequent nighttime bathroom trips can significantly reduce sleep quality without you fully realizing it. If you wake up feeling exhausted almost every morning, discussing your sleep with your healthcare provider may be just as important as discussing your medication. This is also a good time to remember that fatigue can sometimes signal another underlying medical condition. Low iron levels, vitamin B12 deficiency, thyroid disorders, diabetes, chronic kidney disease, heart rhythm problems, depression, and infections are only a few of the possibilities your healthcare provider may consider. Sometimes a simple blood test reveals a treatable issue that has nothing to do with your prescription medication. Earlier, I asked whether you've ever noticed a change in your energy after starting a medication. Now I'd like to ask another question. What helps you feel your best each day? Is it a morning walk, eating a healthy breakfast, staying hydrated, spending time outdoors, exercising with friends, or getting enough sleep? Let us know in the comments, because your daily routine might inspire someone else who has been struggling with fatigue. Now, let's return to the promise I made at the beginning of this video. Why do some people seem to regain their energy without stopping their blood pressure medication? In many cases, it's because the cause wasn't just the medication itself. Instead, it was a combination of factors such as dehydration, poor sleep, untreated medical conditions, inactivity, inadequate nutrition, or a medication dose that simply needed to be reviewed by their healthcare provider. Once those issues were identified and addressed, many people reported feeling significantly better while still receiving the important cardiovascular protection their medication was intended to provide. It's also important to remember why these medications are prescribed in the first place. High blood pressure often develops silently, causing damage over many years without noticeable symptoms. Medications like Amlodipine and Metoprolol have been shown to reduce the risk of serious complications in appropriately selected patients. The goal is not to fear these medicines, but to understand them, communicate openly with your healthcare team, and ensure your treatment plan is working well for your individual needs. Healthy aging isn't about finding one perfect pill or one perfect lifestyle habit. It's about combining effective medical care with daily choices that support your body. Staying active, eating nutritious foods, getting quality sleep, managing stress, taking medications as prescribed, and attending regular checkups all work together to help you maintain your independence and quality of life for years to come. If there's one message I hope you remember after today's discussion, it's this. Never ignore persistent fatigue, but never assume you have to simply live with it either. Your symptoms deserve attention, and there are often practical steps that can improve how you feel. Sometimes the answer involves your medication, sometimes it doesn't, but the safest path is always to work together with your healthcare provider rather than making changes on your own. Thank you for spending these moments with me today. I hope this conversation has helped you better understand the differences between amlodipine and metoprolol and given you confidence to ask informed questions about your health. If you found this video helpful, please take a moment to like it, subscribe to the channel, and share it with someone who may also be taking blood pressure medication. One thoughtful conversation can help someone feel more informed, more confident, and better prepared for their next doctor's visit. Until next time, stay active, take good care of yourself, and remember that healthy aging is built through informed decisions and